Okay, so pectoralis minor, commonly referring into the anterior shoulder, down the arm, typically the medial side of the arm, sometimes into the last 4 digits, and occasionally the medial border of the scapula, similar to the referral pattern of scalenes and levator scapula. It has a similar referral pattern into the arm as scalene as well, and can also be responsible for the neurological symptoms of scalene entrapment. So good to check out both of those if your patient is experiencing any neurological symptoms in the arm that you think might be related to trigger point referral. This is my lovely wife, who has volunteered to be our pandemic body. So for palpating the pec minor, we want to start.
Just stop. I'm sorry. I'm sorry. I'm really sorry. Sorry. Okay, I won't do it again, I promise. Do you want to
I'm
start?
going to put all of this in here.
Okay.
Palpating pec minor in a female patient, we can only access part of it. So you've got a couple options. Either treat in either a sports bra or over top of the sheet, wherever you're comfortable. Start by cross fiber palpating right off of the coracoid process. See if you can get a sense of any areas that are more hypertoned than others. And typically what you can palpate down comfortably to around the rise of the breast tissue. This is a nice easy one to come in and compare bilateral right away by palpating the tendons. And you can also come down and look at this view and see if one shoulder is sitting up higher or not than the other. Now another option for female patients is if you get their hand, if you could just make a barrier here for me where you're comfortable palpating. Right, so now they're in control a little bit more. You can palpate down a little more into those insertions on the ribs. Okay, thank you. Put this hand here if you're comfortable. Common locations for trigger points in the pec minor, right off of the origin, and then around the costal insertions. Take your time warming up pec minor, a sensitive area for a lot of people. It's a good place to introduce some of your fascial release, like cross hands, stabilizing firmly on the costal insertions, spreading into the shoulder. And also a good place to use our shape and mold technique by reaching into the axilla underneath the border of pec minor, grabbing as much of the body of the muscle as you can with a gentle lift and a twist. The same protocol goes for all of our muscles for trigger points, finding a top band with a tender nodule. Maybe right here. How does that feel?
Tender.
Can you give me a number, 0 to 10?
6.
6, okay. Is that okay for you?
Yep.
And instructing your patient in diaphragmatic breathing. Easy through the nose, and as you're breathing out, pretend you're exhaling through a straw. Once that pain has decreased, again, we can choose to follow it in with more pressure 2 or 3 times, or we can slowly back out. Following the compression, we want to reset with passive and active range of motion. So we'll use shoulder abduction for pectoralis minor. So I'm going to show you what I want you to do. So I'm going to get you to bring the shoulder up and down. 1, let me do it first. 2, 3. And now if you could do that action for me 3 times, please. 3, great. Followed by a stretch. We've got a few different options for stretching the pec minor. My preferred option is using the flats of my knuckles, stabilizing into those costal attachments, bringing the arm up and slowly lowering. And some people will be very sensitive, so approach with caution. Tell me when this is uncomfortable or just approaching uncomfortable for you. Yeah, okay. To do a contraction, you can instruct them to gently push their hand up into your arm. So push for 5, 4, 3, 2, 1, and relax. Relaxing for a couple seconds and increase into the next barrier. Repeating that 2 or 3 times and holding the final position for 30 seconds or so. Okay. Another option is stabilizing again at those costal margins and pressing the shoulder down into the table. Okay? Watching that your fingers aren't laying over any breast tissue. The activating force here would be gently pushing their shoulder up into your hand. So can you gently for 5, 4, 3, 2, 1, and relax. And again, gently increasing that stretch. Just try to relax there for me. Holding the final position for 30 seconds. A third option that some people do that I don't do because I find it quite invasive is a cross hands through both sides bilaterally. You can experiment with that, but it's not one I use. Okay, let me just go check that and see, make sure I haven't like